Okay, so very good morning, good afternoon everyone. So in the last video we are discussing about antihypertensive drugs, the drugs which are useful in the treatment of hypertension. So what we have discussed so far, we have covered the drugs which are going to act on central nervous systems. One class of drugs we have already discussed, and that drugs we call centrally acting sympatholytic drugs. And under that class, what we have discussed about clonidine and alpha methyl dopa, centrally acting sympatholytic drugs. Then we have, I told you about second class. Second class is acting on the ganglion, but of course we are not using these drugs. The drugs which are acting here, that is second class ganglionic blocker, the drugs like hexamethonium, but we are not using it clinically because it's going to inhibit your parasympathetic system as well. So clinically we are not using currently the ganglionic blocker. That is the second class. Third, we have discussed, you can block here the transmissions, you can block here, and that will be called sympathetic nerve ending blocker. So in sympathetic nerve ending blocker, third class, we have discussed the drugs. The drugs are reserpine, guanadril and me-tyrosine. So these three drugs we have discussed in earlier video as well. Then we have discussed about when the neurotransmitter release and when they act on the target organs. So we can block here as well where it's attached with its receptors. So for sympathetic, there are two types of receptors, alpha and beta. So we have some drugs which are going to block these receptors. Some drugs are going to block alpha, some drugs can block the beta, and both drugs are useful in the management of hypertension. So we are discussing about alpha and beta blockers, and in the last sessions we have discussed about alpha blockers. So quickly, if I recap you in alpha blocker what we have discussed. So alpha blockers, again these are selective and non-selective in nature. Non-selective alpha blockers and selective alpha blockers. So as its name indicates, non-selective means alpha receptors are of two types, alpha 1 and alpha 2. So the drugs which are going to block both alpha 1 and alpha 2, we called it non-selective blocker. Non-selective means they are not blocking only the particular type of receptor, but they are blocking both the receptors. So we called it non-selective. In non-selective there are two types, irreversible and reversible. And if you remember, in irreversibles I told you the drug phenoxybenzaimine. This is the drugs under irreversible. Irreversible inhibitor means your drug is going to bind in the active site of the receptors through covalent bonds. So you know, whatever the drugs we are consuming, they are not going to act with the whole receptor. For example, this is your receptors, this is your receptor structure. So you know that this is GPCR. So your drug is not going to bind with whole receptor. Receptors are made up of proteins, but your drug is not going to bind with whole receptors, but drug is going to bind with particular site in the receptors where it's going to act. So in this case, this is a site, that's the extracellular domain, and that site we call active site. So drug is going to bind with the active site only, active site of the receptors. So when drug is binding in the active site of the receptors are made up of amino acids. So when your drug is binding with the amino acids of the active site through covalent bond or through strong bond, that kind of binding we call irreversible binding, right? So phenoxybenzaimine is a drug which is binding in the active site of the alpha receptors, but it's going to bind through covalent bonds and through strong bonds. Right, that's why we call it irreversible. Reversible means it's not through interaction is not very strong. Interactions can be happens with van der Waals interactions, electrostatic interactions, hydrogen bonding interactions. So all these kind of interactions are involved in irreversible blocker. So reversible blocker means they are your drug is binding through weak bonds. The drug under this category is phentolamine and tolazolene. Phentolamine and tolazolene. So now I already explained irreversible blocker we are using when the patient is suffering with severe hypertension. whose blood pressure is not controlled. So in severe hypertensive cases, we are using irreversible blocker. So what are these conditions? So one of the classical example is pheochromocytoma. So already we have covered this pheochromocytoma. Pheochromocytoma is the tumor of your adrenal gland, and you know that adrenal gland is playing a major role in the management of hypertension. So pheochromocytoma patients is releasing large number of adrenaline and large amount of adrenaline and non-adrenaline. So large amount of adrenaline and non-adrenaline will result in increase in blood pressure. So that is the conditions where your blood pressure is increased very high, and in that condition we are using irreversible blocker, that is the phenoxybenzyamine. Reversible blocker we are using when patient is again suffering with severe hypertension but for smaller period of time. In this case, in this pheochromocytoma, patients have a severe hypertension for longer period of time. So we are using irreversible blocker. The drugs which we are using as a reversible inhibitor like phentolamine or tolajolene, again we are using when the patient is suffering with severe hypertension but for smaller period of time. That is the difference between these two. Both are comes under non-selective. One is irreversible, another one is reversible. So irreversible we are using when patient is suffering from severe hypertension for prolonged period of time. For smaller period of time, severe hypertension, we are using phentolamine. Conditions where the severe hypertension for small period of time is cheese reactions. So we have discussed this as well, cheese reactions and clonidine withdrawal symptoms. Clonidine withdrawal symptoms. So these are the two conditions where your hypertension is severe but for smaller period of time. So quickly if I tell you about cheese reactions, we have already covered. Cheese reaction means when your for example you took the tyramine rich food. Tyramine rich food is the starting material for the synthesis of your adrenaline and non-adrenaline. So when we are taking excess of cheese, more tyramine, more adrenaline, non-adrenaline will be synthesized. But luckily in our body there is a one enzyme, that enzyme is MAO, monoamine oxidase. So these enzymes will do the degradations of adrenaline and non-adrenaline which are form excess. So in physiological conditions, if I am taking excess of cheese, this MAO will take care of excess adrenaline and non-adrenaline which is biosynthesized and released. But if the patient is taking some kind of medicines where MAO is inhibited, so in that case, if the patient is taking such kind of food who are rich in tyramine, who are rich, means for example he is taking excess of cheese, red wine, so what will happen? In that case, MAO is already inhibited in that particular patient. So MAO is not available to do the degradation of adrenaline and non-adrenaline. So your adrenaline, non-adrenaline will increase in excess amount and your hypertension will be happen, right? So that will be called cheese reactions. Clonidine withdrawal symptom also we have discussed. Clonidine is a drug which is alpha 2 agonist, right? So clonidine is a drug which is alpha 2 agonist, and alpha 2 is presynaptically, right? So if you are doing the agonist of the alpha 2, so the chemicals in the synaptic cleft will be less because it's a break to the sympathetic system. So alpha 2 agonist like clonidine, when you are giving to the patients for a longer period of time, 6 months, 7 months, so what will happen? Here release of neurotransmitter will be decreased, and when neurotransmitters release is decreased, so what will happen? These cells will synthesize the receptors and overexpress the receptors, more number of receptors for adrenaline and non-adrenaline. Then if you have withdraw that drug, for example you have after 6 months you have withdraw the clonidine, so what will happen? Now when you withdraw the clonidine, so the chemical will be released, the released chemicals will be much more here, right? So when your chemical is much more, the number of receptors are much more already overexpressed, so you will get hypertensions, right? So the severe hypertensions, but for smaller period of time. So that kind of hypertensions we call rebound hypertensions. Rebound hypertension means the hypertensions which can be arise after the withdrawal of antihypertensive drugs like clonidine. So you have withdrawn the drugs, then your hypertension, your blood pressure is increased much more. So that is the clonidine withdrawal symptoms, or also be called rebound hypertension. So that we have discussed already, right? And then in alpha blockers, I told you, then we have a selective blocker. Selective blocker means they are going to block alpha 1. Alpha 2 blockers we are not using clinically. We are not using alpha 2 blockers. But we have a drugs which are blocking the alpha 1 and drugs which end with josin like prazosin, doxazosin. So the drugs which end with the josin, we call it alpha 1 blockers. So alpha 1 blockers are useful in the hypertension. How it's useful? Because alpha 1 blockers are present on the blood vessels. So this is your blood vessels. So alpha 1 are there. When adrenaline, non-adrenaline in normal conditions, when it acts, it will result in the vasoconstrictions. So if vasoconstriction is there, TPR will be increased, ultimately your blood pressure will increase. So you are if you are giving prazosin or doxazosin or terazosin like drugs, what these drugs will do? These will block this alpha 1 receptor. Your adrenaline, non-adrenaline is there, but they are not able to bind with alpha 1 receptor. If they are not able to bind with alpha 1 receptor, it will result in vasodilations. And when there is a vasodilation, your total peripheral resistance will decrease. Ultimately, your blood pressure will be decreased. So this is a mechanism of alpha 1 blockers in hypertension. But I told you alpha 1 blockers, alpha 1 receptors are also present on prostate urethra. And I told you there is a one condition that we call BHP, benign hyperplasia of prostate. So if the patient have a hypertension and also suffering from BHP, that is the old age disease, 50-60 साल की में होती है BHP, the drug of choice will be your alpha 1 blockers, right? Because same drugs will be reduce his blood pressure as well and take care of BHP as well, right? But problem with alpha 1 blocker is there is adverse effects as well. Problem with alpha 1 blocker is it could result in reflux tachycardia, and I told you how reflux tachycardia can happen, right? Because when you you are blocking this, vasodilation happens, it will be sensed by the baroreceptors and the signal to the brain, and in response to it, your sympathetic system discharge will happen, your adrenaline, non-adrenaline release. Alpha 1 blockers are alpha 1 receptor are already blocked. Which receptors are available? Beta 1 receptor, which are present on the heart, so it will result in increase in heart rate, tachycardia. So that we call reflux tachycardia. So adverse effect of alpha 1 blocker is reflux tachycardia. And I told you why alpha 1 blockers could result in reflux tachycardia. Another problem with vasodilator is it could result in orthostatic hypotension as well. That also we have discussed how this orthostatic hypotension can be happen. So later on what the scientists have done, they have discovered another subtype of receptors. Alpha 1 is further divided into two parts, alpha 1A and alpha 1B. Alpha 1B are the receptors, you can remember with this word B. B is for blood vessels. So alpha 1B is present on blood vessel and alpha 1A is present on prostate urethra. So if the patient is not suffering with hypertension but the patient is suffering with BHP, and in that conditions you want to block the alpha 1 receptor which is present only in the prostatic urethra. So in that case you want the drug which will block only alpha 1A. So now we have a drug that is the tamsulosin. Tamsulosin is a drug which is alpha 1A blocker and useful in BHP, and it will not result in reflux tachycardia or orthostatic hypotension. Got it? So this is about alpha blockers.